in the UK for dentistry. Our emphasis today mainly would be for the non-UK trained doctors who want to come to the UK and pursue training over here. But we also touch base with the postgraduate dental training pathways in the UK. We may not be able to cover all the topics, but please feel free to leave your questions with us, and we'll try and answer as many as we can. And we might try and arrange another session if we can and if that is required. So for today's session, we have Dr. Abdul Hafiz with us. He's kindly chairing the session for us. He's the consultant GP in Manchester. He's also the founder and CEO of the APPSUK. And then we have Dr. Syed Ali Raza. He's the consultant oncologist at Northwick Park Hospital. He's going to co-host this session with me, but will be joining the session somewhere in the second half of the session. We have about 3 to 4 distinguished speakers with us. Dr. Mehwish Bhatt, who's going to join us shortly. She's a dental surgeon. She's trained from Pakistan, and then she moved to the UK for further training and has recently gone through the licensing pathway, so probably would be the best person to speak about this topic. Then we also have Dr. Mohamed Sawyer. He's graduate dental surgery from King's College London, and is clinical fellow oral and maxillofacial surgery in Queen's Victoria Hospital. Unfortunately, he's currently not feeling very well. He might will join us at some point, but he was going to speak about the dental surgery pathways in the UK, but I'm not sure if he'll be able to join. I hope he's feeling better. Then we have Dr. Asmar Akram with us. He's done his BDS from University of Glasgow and is member of Royal College of Physicians and Surgeons of Glasgow. He's also done masters in dental implantology from University of Central Lancashire and is a trainer for pharmacists in Glasgow. He's also graduated from Darul Uloom Bury and Darul Uloom Blackburn, and is teacher of Hadith, Fiqh, and Islamic jurisprudence. And he's going to talk about some of the options available for dental surgeons after completion of their training. So this is a brief overview of our distinguished speakers. And in the end, we have Dr. Ali Tahir. He's the assistant professor currently working in Pakistan, Faisalabad Medical University. He's the assistant professor of Department of Oral Pathology, and is going to talk about current situations and opportunities in Pakistan. So shall we start with Dr. Asmar Akram? So over to you, Dr. Asmar Akram, shall we?
Assalamu alaikum wa rahmatullahi wa barakatuhu. First and foremost, my thanks goes to Dr. Abdul Hafiz for this invitation, Dr. Aruj for doing such a nice job on the introduction. Reality is that I don't really think I'm worthy of any of the accolades that I've earned, but I'm going to share what little I have from my small experience of life. I thought I did request Dr. Abdul Hafiz that if it's formal, I can go through some slides, but he mentioned that it's quite informal. So I'm just going to talk about my experience, and throughout my experience, I'll try to highlight various options to the viewers about what they may wish to consider in terms of postgraduate training pathways in dentistry. And then at the end, if the honourable guests, the listeners, they have any questions, I'm happy, and perhaps from those questions they may actually learn more. So and again, I'm simply stating this for the mere fact of my experience. It doesn't, I'm not here to boast, because reality is, Allah subhanahu wa ta'ala says in the Quran, هَلْ أَتَاكَ عَلَى الْإِنسَانِ حِينٌ مِنَ الدَّهْرِ لَمْ يَكُنْ شَيْءٌ مَذْكُورًا. Does man not remember a time where lam yakun shay'un madhkura, that he had no BDS, he had no MSc, he had no BDS. So these things that I'm mentioning, it's not for fakhr or to be proud. It's just simply what I happened, Allah subhanahu wa ta'ala enabled me to do. And from then, maybe it's something that the other people may wish to undertake. So first and foremost, I was born in Glasgow. It's one of the largest cities in Scotland. I spent approximately 31 years in that city. My parents stay there, my family is there, not my in-laws, etc. So I visit quite regularly, and the clinic I am in today is also based in Glasgow, which is part of my practice ownership portfolio, which I went into. Then approximately 4 or 5 years ago, I moved to England. So I now primarily reside right now in Bolton, where I also undertake sort of a joint venture, as Dr. Arouj highlighted, spending my time within clinical dentistry, concentrating on dental implants. And obviously, I spend most of my time in the madrasa and the madaris system. And if you guys want to know why, then I will share that with you at question time. In terms of training, as Dr. Arouj mentioned, my education was primarily, in Glasgow, primary school, high school, university, and when I was in university, the academic side really appealed to me. That was originally what my mindset was, and through the fadl of Allah subhanahu wa ta'ala, not through my own abilities and efforts, I developed quite a good connection with various professors. I started writing my own papers as an undergraduate. I presented as an undergraduate. And for me, dentistry wasn't ever about just passing. It was about trying to do the best. So that's my first point of advice to anyone that's coming from abroad, that whatever you're going to do, put everything into it. And inshallah, you'll see the fruits, even if other people don't acknowledge it. Thereafter, well, towards the end of my BDS undergraduate career, for UK graduates, 99% go into what's referred to as vocational training. So this is a mandatory 1-year postgraduate undertaking with, in England, they would refer to it as a deanery. In Scotland, they would refer to it as the vocational training practice post, where you are essentially working under a supervisor. And at the end of that, that enables you to work for the National Health Service, okay, which is one pathway in dentistry. The reality is most new graduates will work in the NHS for some period of time whilst they build their skills. However, when I said 99%, I was a bit different, because the Glasgow Dental Hospital, they brought out a scheme, they called it at the term Dental Foundation Training, where rather than working in general practice under vocational training, you could defer for 1 year and you could work in the hospital straight after you graduate, alternating through the various dental specialties. So when I say dental specialties, everything from radiology to oral surgery, prosthodontics, restorative dentistry, and so on and so forth. It's not designed to make you a specialist by any means. I'll speak about that in a few seconds. But what it does do is it gives you a very good flavor of what all, I suppose, similar to what doctors may do when they're doing their various ST rotations or their foundation rotations. So after I progressed, and again, that down to quotation, I don't know whether that's available to graduates abroad. I apologize to Dr. Abdulvisa that I'm not well versed with what foreign students are allowed or not allowed to apply for. But thereafter, during that year, my mindset changed. And when I say changed, I still had a love for academic dentistry. But just to put it blunt and being 100% honest with you, the politics of the system, you had to be in with certain people. You had to have acknowledgement for certain people. To me, that was, and I've seen lots of people getting treated fairly and unfairly. I've seen certain people being prioritized when it came to certain posts. So I thought to myself, this is not what I want from life. I do want to become good at what I do. And that really put me off pursuing a career in academic dentistry. But I'm not saying that that happens everywhere. I probably say it may happen in some places. So if somebody wants to progress with what's known as the formal specialist route, where you obtain some general practice experience and then you apply to various specialist posts, be that in a subspecialty, in restorative dentistry, periodontology, etc. So that's one way that you can progress your career, with or without an academic component. So the longer schemes, the specialist training is normally about 3 tiers. If it's something more complicated, it may be 5 years. And if you wish to do a PhD or some other studies, then it would be an additional few years. So that is one way, and that is what some people do to become to become who they are, or to become good. The other reason why it wasn't really appealing to me was the independence really gets removed from you. It's similar to a doctor. He's always, most of the time, not always, he's always going to be working subject to his contract with the health board of the hospital. And for me, dentistry was a priority in life. I wanted to become good at it, but dunya mein aur maqasid the, there was other purposes I had. And then that's the reason why I went into general practice. Now, the general practice route, I'll tie my presentation up, it's a bit different, where you function. When I say the word dentist, obviously, mashallah, there's too many doctors here, so we'll know about the profession. But the average Joe public, the person in the public, when you say the word dentist, they think of the high street dentist, the dentist on the corner of their street, which is where majority of dentists work. Now, the thing with a dental degree is that you can, function just by doing basic dentistry your whole life. That may make you happy. But a lot of dentists, what they're doing is they want to concentrate on areas which they feel that they are more interested in or they want to improve. So, for example, my line, I concentrated on implantology. I undertook further training, a master's at UCLan, and that's the majority of the work I do now. It's more surgery focused, and that's just my interest. It is, in comparison to other areas of dentistry, perhaps more profitable, but that wasn't really my intention behind it. I was just simply pursuing what my interest was. Now, the advantage in general practice is that, yes, you can facilitate what you want to do when you want to do it. You can go on courses, you can join part-time degrees, you can pay for your training, but that's the catch. It is more costly as opposed to going into a paid salary post. You will spend thousands and thousands of pounds just trying to train yourself on something that you want to do. That may be implantology. A lot of dentists, they become very good with braces. So dentistry is quite strange in the UK, where there's an overlap that, yes, you may need to become a specialist to do certain cases, but with your BDS degree, you can actually do certain components of what a specialist would normally do. So there's lots of dentists out there that have, for example, orthodontic training. They've done lots of fixed therapy courses, and they become very good. They understand their limits, as every practitioner does, but they become very good at providing an orthodontic service to their patients. So tying all things off there, that was I wanted to sort of describe the two line. There are some tertiary lines in dentistry. If you want, not many people go into these lines, but maybe you want to go on to, the armed forces, maybe you want to stay within the Navy. These are other options that are open if you want to go then that way. I didn't for various reasons. There's also other people that may wish to just use the dental degree as a platform to other degrees. So some dentists may become, medical legal advisors with a law degree or an LLB, or they may decide to come on and become teachers, or they may decide to just completely change their path. It's just, at the end of the day, it's what you want to do. For me, general practice gave me that independence. Not only that, because I moved, as I mentioned, into practice ownership, that brings a whole different dimension into your life, where you're no longer just a clinician. You're now somebody who runs their own business, and at the end of the day, you're responsible for not only the training of other people, but the activity of other dentists. And yes, it's very rewarding. You can earn lots of money if if things are done correctly or things go your way. But that's not always the case. Many dentists, they always quote the suicide factor. One of the reasons will be the financial pressures, loans from banks, owing people money. So it's not all hunky dory. People will always think, oh, look at him. He has a plethora of practices, but inside, when you're waking up at 2 o'clock in the morning with an email from your head nurse saying, I've been excited to accept a new post, then you're worried for the rest of the day, thinking, how am I going to replace her? Okay. And that's the reality of general practice, especially with COVID, the practice principles. I joke with some of my colleagues. I would say every gray hair on my head is due to these sort of stresses that I used to once have. So then, as practice ownership, when I sold part of my businesses, I went down to a complete minimum. I do have a partnership, which alhamdulillah pays bifadlillahi ta'ala for the bills, and I spend my time doing other things, which I'm not mentioning today, because unless you ask me about them, because the purpose of this seminar is, as I mentioned, to concentrate on dentistry pathways. So that's me. I've talked for 10 minutes. I don't want to bore you people. I think it might be wise if there are any people that have any questions about what I've done, how would I do differently. Maybe you disagree with my reasoning, maybe you have other suggestions. So I think I'll open the floor if that's okay, and I'll maybe take a few questions, and then inshallah you can move on to much better people that you should probably be speaking to and seeking advice from. Thank you.
Thank you, Dr. Akram. That was a very good overview. I have a question about, though we don't have any questions, a lot of questions over here, but I have a question. How long the BDS course is in the UK? As in, back home it was 4 years. How long is it here in the UK?
On average, 5.
5 years.
Yeah.
And then you have
the majority of institutes. I can't remember. I think there might be around about 18, 19 dental schools in the UK. You can Google that because there's new ones that open. And a majority of them do run a 5-year undergraduate bachelor's program for a BDS. There are a couple of institutes like Leeds University that don't actually call it a BDS. They've got a different name for the degree, but it's essentially the same thing in the same time. Sorry, you were saying?
Yeah, and then afterwards, you have to do your, in medicine, they do F1 and F2 after that. Is it same in the BDS or is it different?
Yeah, as I was mentioning, sorry, I maybe spoke too fast, that traditionally they call it a vocational training post. They did change the name at one time in Scotland. They call it FY1, Foundation Year 1, similar to the medic system, but it's the same thing. They have to do 1 year if they wish to practice as NHS dentists. Most people do that because you're so young in your career. Nobody's going to give you, for example, a job in a private practice. I should have mentioned that in my presentation, that whether you choose to do NHS or private dentistry does influence your career pathway. Most dentists, they enjoy doing private dentistry. It's more profitable. You spend more time with patients, but you need the skills to do that. So to answer your question, technically speaking, you don't need to do that 1 year foundation training to do, but very rarely will you be given a position as a private practitioner because of your limited skills. So most people will go ahead and do what's known as Foundation Year 1 or the vocational training year. There's different names for the same thing.
Thank you so much. I have a question, which is again which would probably need quite a lot of time. I think that will need an extensive answer. We'll come back to it, Dr. Mohamed Sawyer. We'll come back to it soon. Shall we first move on to our next speaker, who's Dr. Mehwish Bhatt. She's the dental surgeon, graduated from Pakistan, and then she has recently completed her licensing pathways. Is currently working in Scotland as GDC registered dentist. Mehwish, can you hear us? I think you were struggling to connect, but I can see you now. Yeah, you're there. Sorry, you're mute. We can't hear you.
Can you hear me now?
Yeah, sure. Thank you. So
All right.
Over to you, Dr. Mehwish.
So thank you so much for today. So yes, I'm doing my vocational training in Scotland. It's been like 4 months since I've started my training, and it was a very long journey. And I'm here to help guide my fellow dentists from Pakistan.
Thank you.
So what questions do you have from me?
So basically, we would like you to give us an overview of how did you get through your pathway for licensing procedure.
So like I said, that I'm a graduate from Pakistan. And in order to register yourself in the United Kingdom, then you need to pass your exams, which is part 1 and part 2. And unlike lab, you need to do your house job, which is like 1 year of internship in Pakistan. So you have to do that first. And after doing that, there's a couple of paperwork that you need to fill and then sit for part 1, which is a 2-day exam based on MCQs. And then once you clear that, then you have part 2 exam, which is based on 3 days practical, 4-module exam, quite extensive, quite hands-on and very stressful. So once you're done with that, then you get your results. And after that, they ask you, where do you want to work? So depending if you want to relocate, which some people are willing to, they have to submit the specific form and paperwork for that dairy, like one of my colleagues mentions in England, and in Scotland, there is health board. So I did all that. And after that, of extensive paperwork, I've just started my training here.
Great, thank you. We don't really have any questions at the moment. So shall we move on to the next speaker then?
May I ask Dr. Mehwish, please specify the name of the exam, part 1 and part 2 of which exam?
So basically, there are 2 exams that you can sit. There is ORE and there's LES. So the price is the same, the pattern is the same. It's just that some people prefer LDS, some people prefer ORE. It's just how you manage to get the booking, which is online. So I sat ORE, and that's how I got my registration.
And how long is your training expected to last?
So To be honest, it's the rules have changed recently in England. It's 16 to 18 months of compulsory training if you're full-time, but in Scotland, it's still 1 year. So depending on to move up north, then you can just prefer Scotland, or if you do not want to relocate and stay in England, then that's what you have to do.
And how do you register yourself for the training? I'm sorry for all these questions because undergrads are watching you.
So basically, the first part is to secure a job. So you apply for a vacancy on platforms like Indeed, BDJ, and you can even ask from friends if they know someone who's looking for a VTE trainee. So once you are talking to your employer, they ask you for some documents, and one of the documents is the paperwork, which is like an application form to register yourself as a trainee, so that the health board or the deanery knows that whose list number are you working with. So for example, I'll give you an example. So let's say you finished your ORE, you got results, you passed your exam, and you managed to get a job interview. Once everything is finalized, they will just ask you to fill out a bunch of forms, which requires you to do your blood work, which requires you to tell them about your experience with various things like dentures, root canals, how many have done them, and how much confidence you have them if you've done them independently or under supervision. And then blood work, very detailed references from your trainers back home, which is done by email, so you do not have any interference with that. And that alone takes, in England, that alone takes a couple of months. But if you're doing it in Scotland, that's just, it took me 5 weeks.
I think there is a very relevant question here. They said, when should you start studying for the ORE and what materials are recommended? Do you recommend any special material, any specific books or etc.?
So to be honest, for ORE1, you pretty much need 2-ish months if you are just by yourself, if you have no responsibilities, and if you're not in a full-time employment. 2 months is more than enough for part 1. It's just an MCQ-based exam, and the course is pretty much the same what we study in our home countries, except for the law and ethics, which is obviously tailored according to the UK guidelines. So part 1 is comparatively easy. So when you jump on to part 2 after clearing part 1, that's quite hands-on. And to be honest, it's a bit different from what you study in your home country. So you are required to do some preps on the mannequin. In indirect vision, it's crowns, it's different cavities, it's root canals, anything but extraction and dentures. So you're supposed to do that on the mannequin, and while doing so, they just notice your cross-infection control. They notice how much you're reducing and how conservative you are, and they ask you for the justification for any prep or any differentials, any treatment plan, any x-rays, or any final thing that you've told to the patient. You basically need to back it up with justification. So that's what they're looking for in the mannequin part. And then there is medical emergency, which is hands-on as well. And then there are some medications that you have to learn according to the guidelines. And then obviously there's a big module on treatment plan, which obviously would let them know if you have a very good grip on conservative and preventive dentistry. Because obviously you want to look for a safe dentist who's willing to offer a patient the most conservative options in an ethical way. So that's...
I have a question from Mashal Fahim. He's saying, also since there are such few seats for ORE, how did you manage to book it?
Your internet speed needs to be very, very fast. My booking took place within seconds, and within seconds, there would be a screen saying it's fully booked, 144 seats per exam. So initially there used to be 6 per year, now there's 3, and during COVID there was no exam. And you have to be very lucky to secure the seat, to be honest. Not being discouraging, but fingers crossed.
Okay, and then they're saying that I think there's a few other pathways as well, ORE, MFDS, MSc. If we could please know a detailed outlook for each.
So basically, if you want to register yourself, that's just ORE or LDS. So even if you're a postgrad, you cannot touch a patient unless you do not have a registration, which is done by ORE or LDS. So MJDF and MFDS is just a supra qualification, but it does not allow you to touch the patient. It's just a postgrad. So you can have as master's as you want, but you need to do the exam in order to practice here.
Just to make it clear, what Dr. Butt is saying is that the ORE exam is to obtain a General Dental Council registration. The word General Dental Council is important because that is the governing body for dentists within the UK. And I'd like to add, Dr. Butt is probably very smart and clever, which is why she managed to do it, the ORE training in 2 months. I know some, 1 month.
Who takes 3 to 4 months.
Yeah, okay, yeah. There's lots of other people that may need more time or less time. And one other thing I wish to add in the Scottish system is that although for UK graduates, for Scottish graduates, they normally go straight into VT because they're from Scottish institutes, there are foreign dentists that can apply for exemption, whether or not they will get it after their registration based on what is known as, you might want to write this down, VT equivalence. It's called VT equivalence. So for example, if you are, say you're in Pakistan, you're a professor, but for whatever reason, you want to come to our little dodgy little country and practice, NHS dentistry, you can prove that, you know what, I've been in dentistry for 25 years. I've done this training. I've done thousands of root treatments. I've done thousands of etc. And then I don't really need the training of working under, an NHS practitioner in order to secure a list number. What they may do is they may come back with certain conditions to say, okay, we understand clinically you're fine, but in terms of what, again, Dr. Butt mentioned quite rightly, is that we need you to get up to speed on the legalities and the ethics in the country. So we want you to undertake educational components, or we want you to undertake 2 months more of dentistry. So that's one other option that's available. It's known as VT equivalence. And I think it's actually primarily designed for foreign dentists. But Dr. Butt, Jazakallah, that was I actually really enjoyed listening to you because I often get questions from Pakistan, and from now on, I'm just going to give them your phone number, if that's okay.
And there are a few more questions about the pathways post-graduation. I think I'll direct them to Dr. Akram after this talk, but I think let's focus on the pathways for licensing pathways at the moment. So there's another question from Dr. Myra. She's asking.
Sorry, Dr. Roj, if I can.
Yeah, sure.
I believe let's move to the next speaker.
Next speaker, all right.
Come back to the questions because there will be a lot of questions popping up in the session, and we have Mohamed Sawyer, we have Dr. Akram. So let's move to the next speaker.
Sure. So our next speaker is Dr. Mohamed Sawyer. Thank you for joining, Dr. Sawyer. I hope you're feeling better now. He's a graduate from dental surgery, graduate in dental surgery from King's College London, and is currently working as clinical fellow oral and maxillofacial surgery in Queen's Victoria Hospital. You're there, can you hear us?
Hi, good afternoon, everyone. Thank you for the wonderful talk so far, and thank you for the excellent overview. My name is Mohamed Sawyer. Apologies, I've contracted COVID, so my voice is slightly changed, so I may cough during the presentation. By the way, I'm okay. So I am a medicine first graduate, actually. I'm currently a dental student after completion of Royal College of Surgeons membership and diploma of neck surgery, and I'm on the maxillofacial surgery training pathway. When I was a medical student and beyond, I've been extensively involved in training aspects for postgraduate trainees and helping people obtain post-surgical interview jobs. So naturally inclined to help the same in the dental specialty. I'm just going to do a brief PowerPoint presentation, if that's okay. I'm going to just share my screen. I just want to check if you're able to see my presentation. Just give me one moment. Are you able to see the presentation?
Yes, we can see.
You can see, okay. So in terms of the training pathways in the UK, there are a number of routes and registrations and considerations. So first question is, where did you qualify from? And then the other question is, do you have any recognized overseas qualification? And whether do you have a recognized European diploma, you may be a British citizen who's trained overseas, or are you in a recognized specialist postgraduate training in your home country? So based on whether you say yes to these questions, there are a number of routes available. So for example, you have temporary registration with GDC, There is the overseas registration exam, as Dr. Butt elaborated on, and there's also an option of the LDS, or the License in Dental Surgery exam. The main difference in the LDS is that it's only available much less in terms of frequency in a year compared to the ORE, but in generally, because of the pandemic, the ORE has been very difficult to gain access to. The third possibility is the Medical Training Initiative, which is a Tier 5 program. So if you are recognized postgraduate training in your home country, as part of a government-sponsored and exchange scheme, you might be able to come to the UK and spend some time here. And otherwise, the main two routes are the temporary registration or the overseas exam. Temporary registration is the registration granted for approved training posts in hospitals, in the NHS, dental schools, and approved institutions. It is not granted for work in general private practice or in the community dental practice. Temporary registration directions are granted for a minimum of 180 days and a maximum of 365 days at a time. So it has to be renewed. There are means of applying for it up to a maximum of 1,826 days or 5 years. It is granted only for the purpose of supervised training, teaching, or research. Completion of the maximum period of temporary registration does not lead to full registration, which is necessary for practicing dentistry in the UK. To obtain full registration, you need to hold a recognized qualification and meet the criteria, or as Dr. Butt said, pass the ORE exam. The overseas registration exam, very briefly, is an exam that the overseas qualified dentists have to pass to register in the UK. It allows the dentist to work unsupervised. The ORE tests the clinical skills and the knowledge of the dentist, whose qualification is not recognized in the UK. So part one is designed to test knowledge in relation to clinical practice. It has two computer-based exam papers. Part A covers clinically applied dental science and clinically applied human disease. And Part B covers the aspect of clinical dentistry, including law, ethics, health, and safety. So much of our distinguished speaker said earlier, the UK degree is predominantly based on communication skills, ethics, patient-centered care, which form a heavy basis of our curriculum in the UK. So in addition to having basic scientific knowledge, these key aspects of and awareness are very important. Part two is designed for the candidates to demonstrate the practical side, and again, they're mapped to the learning outcomes in line with the UK graduates. I think the cost is £2,929. There is difficulty in terms of getting onto the exam, particularly during the time of the pandemic, and there are some components of the exam that I've mentioned here. Moving on, the Medical Training Initiative. So this is the Faculty of Dental Surgery of Royal College of Surgeons of England, where they're able to sponsor a suitably qualified postgraduate dentist for a period of UK clinical training in an approved post. The MTI is a national program designed to allow a small number of doctors and dentists to enter overseas for about a period of 2 years. And essentially the good thing about this is that they're able to learn from experienced consultants in the UK National Health Service. The temporary registration is still required from GDC. It is tailored to the requirements of international training fellows. The post usually is a locum appointment lasting more than 3 months, and it doesn't lead to a national training number or completion of specialist training. It can be part of a scholarship, governments overseas or Commonwealth. This is just very briefly some criteria, and I've got some links at the end of the presentation where you can look into this further. So just some evidence from literature in terms of what's been happening to overseas training and dentists coming to the UK. So Ashiti 2021 broadly categorizes them into Group A and Group B. So Group A are overseas qualified dentists who have never been into UK and have never been to the UK for non-dental career-related reasons, for example, short-term visitor or spouse. Group B are overseas qualified dentists who came to UK to undertake a higher degree, so an MSc or a PhD. Both need to apply and pass for the exam to be able to practice independently. Now, there's some interesting considerations in terms of these both two categories. So challenges to the ORE, apart from the months and months of preparation, as Dr. Mevish kindly stated, there are other considerations. In the pre-COVID era, these used to be held twice a year, and there were about 100 candidates per exam. Conversely, LDOS was only held at least once a year. In the current times, it has been very difficult for the trainees to get onto this to the ORE. The government is planning some contingency measures to address the problem of recruitment, which I'll talk about in a minute. So there is the other way to seek postgraduate training in the UK, which is the academic route. Obviously, it has challenges as with any training. The tuition fees for these programs are considerably expensive. So for example, if you join King's College London to do Clinical Dent in perio, you will end up with a qualification which will allow you to work as a periodontist in the UK, which is recognized by Royal College of Surgeons. However, the problem lies is that the cost is about £50,000 per year, which is eye-watering. There are some grants offered to clinicians if you are considering masters or a PhD, but again, you need to have a job in order to be a clinician, and then it brings you back to square one of needing the requirement of how to get the GDC registration. There are positives. So as you said, so there are a number of institutions, Manchester University, King's College London, UCLan, and they are offering these courses. Grants may or may not be available. I think the best thing is to speak with the university and check on your individual circumstances and see what's on offer. And then it's also very important to check what is the ultimate outcome from these courses. For example, a perio postgraduate degree or prosthodontics, that's recognized as a postgraduate training. However, the orthodontics isn't, and for that you have to go via the national selection system for the purpose of completing specialist training. So there are some government considerations, alternatives to ORE, and they are actually talking about improving the scope of practice and bringing in a one-year supervised post under temporary registration in hospitals. This is again in the presentation. I will leave that so you can read it later. So again, there are some contingency plans. Just to say, the training in the UK is very, very competitive, and even for the UK graduates alone, there is a huge number of applicants, and the job is not guaranteed. It is a competitive entry into DCT1, DCT2 if you want specialist training. There are other options available, for example, foundation training. Again, it's competitive entry post-qualification. So in terms of the postgraduate specialist training in the UK, you have to enter DCT1 and DCT2, and you need to achieve appropriate outcome of completion. For example, orthodontics, oral medicine, oral surgery. I have a couple of friends who are actually doing oral surgery up north and in oral medicine, and the job competition ratio could be up to 50, 35 applicants per place, if not more. It's very competitive, so I would recommend the undergraduates in the early years to focus on audits, research, and CPD to boost up their CV. And again, it requires completion of MFDS or MJDF exam by Royal College of Surgeons. So personally, from my experience of having done Royal College exam, when I finished my dental school, I'm exempt in part 1. A lot of my colleagues actually say that we should do this exam if you are an overseas dentist around the time in doing the ORE, as there is a considerable overlap in terms of learning and learning objectives. Finally, just a very small thing in relation to, obviously, I work as a maxillofacial SHO and a registrar in 2 different hospitals. So dental core training, is that an alternative or viable option? So there are a limited number of DCT posts available for overseas students. You may be somebody who's a British citizen from overseas, so you will not have a visa requirement. If you are from overseas, you will need an appropriate visa. You can gain temporary registration whilst waiting to attain competencies or to complete your ORE or the MFDS exam. The other thing I've noticed is that over the years, a lot of trainees have come from abroad and they completed their ORE exam and they did SHO work for a number of years in dental setting. Some of them decided to consider doing medicine for 3 years. And if you've done an MFDS, then you can actually enter. There are 10 universities in the UK offering a shortened medicine course, which will allow you to become a maxillofacial surgeon. And just because I'm inclined to maxillofacial surgery, I would say it's a fantastic specialty. It has the full scope of head and neck reconstruction and as well as dental rehabilitation. So that's something to consider if if something that interests you, or as a viable alternative. So these are some references and some further reading. Any questions, please?
Thank you, Dr. Sarwar. We do have quite a few questions, but I would suggest maybe we should just move on to our next speaker, finish off with our talks, and then we can answer all of these questions. There are quite a few questions over here, I can see, and Dr. Bhatt is already answering some of them, which we would want her to speak on the speaker as well. So moving on to Dr. Ali Tahir. He's the Assistant Professor, the Department of Oral Pathology, Faisalabad Medical University, and is going to talk about the current situations and opportunities in Pakistan for dental surgeons. Thank you, Dr. Ali.
Thank you, Dr. Arooj and Dr. Ali Raza for inviting me. And I suppose I think most of our participants that are listening are from Pakistan. Am I right, Dr. Ali Raza?
Yeah.
Okay, so before I talk on this topic, pardon my English if it's not perfect. Before I talk about the pathways in Pakistan, I would like the viewers and the participants, I would like them to think. I'm seeing a lot of questions. They're asking question in a way like, what about a person who has done his training? How can I go to UK? Or someone is asking, I've done my master's in public health. How can I go to UK? My message to all the participants, you should first understand the structure of post-graduation and graduation programs in UK. And you should try to understand what are their requirements? What do they expect from you that when you arrive in UK, these are the skills and abilities that you need to have. But the way we think in Pakistan, we want them to adapt to our qualification and adjust us somewhere in the UK, right? So please try to, the very purpose of this today's symposium is to make you understand how things are structured in the UK. Okay, as far as Pakistan is concerned, now I've been listening, it's been very knowledgeable for me as well. In UK and Scotland, I've seen the government regulates a lot of things like ORE exams and the postgraduate slots and exams and all the other things. But in Pakistan, we see that a lot of things are unregulated, even a lot of dental schools that are popping up in every part of the country, and they're not registered, and it's rather become more of a business. I think the total number of dental schools in UK is less than the number of dental schools we have only in Punjab. And we've also seen in the last few years that these dental schools have evolved themselves into universities, and they're now offering postgraduate degrees in academics on themselves. I mean, without any approval from the higher authorities, from HEC or from PMC, Pakistan Medical Commission. So what this means is students enter into dental schools, they enter into postgraduate academic degrees, and this has been my personal story as well. I graduated from Demont. It's considered to be one of the most prestigious government dental schools in Pakistan, and then I entered in postgraduate MPhil exam in the University of Health Sciences, which is supposedly a government run university. And when I graduated out, I completed my MPhil. I was told that I'm not registered with, my degree is not registered with Pakistan Medical and Dental Council. And I had to fight the legal battle in courts and all that. So it's a lot of mess. We are developing, we're still evolving in our medical and dental education, and especially in post-graduation. Only the regulated and structured postgraduate options that we see are by College of Physicians and Surgeons. They've managed to regulate their trainings, and the structure and the programs are pretty well organized. And after central induction, now they are also regulating the number of trainees that enter into the program. So I will start from the basic. We have a 4-degree BDS or dentistry undergraduate program in Pakistan, 4-year degree, and then we do 1 year of house job or internship, in the same institute or in a different institute. And then the postgraduate pathways are limited. There's not a lot of them. Either we can go to College of Physicians Surgeons Part 1 exam. If we pass it, we have 4 training modules in operative dentistry, in orthodontics, in oral and maxillofacial surgery, and in prosthodontics. These are 4 CPSP regulated training modules that last 4 years. And after 4 years, we have to pass Part 2 exam of CPSP, after which you become the fellow of College of Physician and Surgeon. The other pathways are, like I said, on academic side, the master's and MPhil programs, which are not very well regulated by a central body. Some of the universities claim that they have accreditation from HEC. Some of them claim that they have from Pakistan Medical Commission, but it's an ongoing process and there are still legal battles being fought, and a lot of universities are doing it on their own. So students end up just getting into any program that is convenient to their location or to their personal circumstances. So I think today's symposium was very well elaborated by Dr. Mavish, but how if you plan to move into UK or Scotland, how after graduating from Pakistan. So I think she explained very well how you have to go through the ORE exam and get a training over there. And if there are, there is one way to summarize it, I would say we have a lot of dental schools producing graduates, but then the path becomes very narrow, and there are very limited opportunities, because even in CPSP training seats have also become limited, and students even after passing Part 1 exam of CPSP, they find themselves unable to find a training slot for years, sometimes 2 to 3 years even, and sometimes even the Part 1 exam expires. So it is still in the evolution process. Our postgraduate programs are still undergoing the regulatory structures and all this. So I would welcome any questions if anyone has.
Thank you, Dr. Tahir. We are hoping that the situation in Pakistan will get better with time. I have a lot of faith in Pakistan and Pakistani people's resilience, and I'm pretty much sure that things will get better with time. We do have quite a few questions. I would hand over the stage to Dr. Raza now. There are quite a few questions, and if he can answer us, if he can help us get those answers, please. Thank you.
Thank you very much, Dr. Ruj. I can see that Dr. Asmar is back. I believe there is a talk by him as well. So do you have a few minutes if you want to share your experience and the guideline for the doctors, and then we would move to the question and answer session.
Dr. Raza, actually, Dr. Akram has already spoken. He was the first speaker.
Doctors, we like the opportunity to speak on stage, but on this chance, I don't need twice, once enough.
Okay, sorry, because I joined late and I read that message. That's why I was.
No problem, no problem.
So coming back to the program, we have Dr. Ali Tahir, as he has spoken, and he has actually told to us about the current situation in Pakistan and the frustration and what are the problems that dentists there are facing. One thing to mention about Dr. Ali Tahir, he's a travel blogger. He has exposure of whole Pakistan. He's very much motivated, and he's in touch with hundreds of dentists. So I would ask him actually to do this question and answer session and to ask the questions, because we are medics from medicine side, we don't understand the problems. So Dr. Ali Tahir, you can see the chat. Please ask the questions. Our panelists are there to answer them.
Okay. So I was looking at some of the questions. Do we have Dr.
Question directly without mentioning the name.
Okay. Some of the participants are asking the requirement for after completing College of Physicians and Surgeons training, 4-year training, what are requirement to be registered in that specialty in the UK. I think one of our speakers has elaborated it, but I think it needs to be summarized again.
So Dr. But if you can apply this, if someone has done FCPS, done with the postgraduate training and specialization in Pakistan, how they get themselves registered? I believe they still need to do the licensing exams.
Yes, they still need to do the exams, but there is a form because when you have to sit the exam, you need to fill out the forms first. And one of the page specifies how many hours you have done in Pakistan under your mentor. So as a house officer, you're supposed to do 1,600 clinical hours. But of course, when you're FCPS, then the clinical hours increase. So that should count. But at the end of the day, you need to pass the ORE to work here as a dentist. So to be honest, even if you're an FCPS, you still need to study for the exam.
So as per my understanding, more important for our trainings there in Pakistan is that they should maintain a good logbook. That logbook should be as per the curriculum of or as per the requirement of the Dentistry Council in the UK. So when they fill the logbook, when they submit the cases, they should fill them in a way that it should be accepted by the Dental Council here. Dr. Akram, do you want to add anything? Or Dr.
No, I'm not happy with that.
Okay, perfect.
Okay. Another thing is that we missed our master programs in the UK. A lot of our graduates get registered in those master programs in different universities in the UK. They last about 1 year MSc programs. It's quite easy. I don't think we have an MSc in our panelists, so I will shed some light on it. It's quite easy to register into such master program. I think one of the questioners participants asked this question. Once you graduate, they don't require a house job. They just want you to be a graduate from Pakistan, and then they will register you with whatever their first semester fees is, and you can move there and complete your MSc and come back. It is quite easy. There are different basic sciences programs like in dental materials, and some of the clinical programs are 3 years. They last 3 years, and they are very expensive. If you can afford them, some of the graduates I've seen have completed them and returned to Pakistan. But what are the what is the scope after completing MSc and then settling in UK? That I'm not sure about, because I think Dr. Smart can better guide us.
I'm going to answer one point on the MSc and come back to your point about settling in the UK. My advice to people is that be careful what you're choosing and know why you're choosing it. I know dentists, UK graduates, my friends, who picked, for example, an MSc in Restorative Dentistry, but they did it too soon after graduation. Because, you know, in order to take advantage of advanced training, you need to have made mistakes in your life. You have to have, you know, some basis where you can apply that postgraduate knowledge. So if you're just doing an MSc because it looks good, but you're not sure, sometimes it's better on deferring it. So my own personal example, if I had placed dental implants or I had some experience of it, I would have taken more from my master's in implantology. I still passed, alhamdulillah, I passed with distinction. That's not the point, but practically you want to get the most out of your MSc, so know what MSc you're doing. Second point, why are you doing the MSc from a registration point of view? See, what is the biggest problem that we have in the West, okay, particularly in the UK, and I need to spend time to relate this to you guys, is that we've developed a defensive clinical culture where when you're practicing, you are making decisions based on the fact that you don't want to get sued or you don't want to lose your registration. Now, what's good if you have a master's is that if, for argument's sake, you had to go in front of the dental council, a treatment went wrong, okay, especially because when you hear the medical legal experts, the cases are on the rise. We're almost following the American culture of litigation. Small things, you know, clinical negligence, the claims are going up and up. But if you have advanced training in a specific procedure, it does help, you know, when you go in, if you were to go in front of the GDC. Other things that help is, number one, your previous experience that you have logged. And as my right honorable friend, Dr. Ali Tahir mentioned, you know, to have a good logbook to say that I know this process went wrong, but I have done this 40 times before and it went fine. Here is the evidence. That helps. Number two, you obviously the normal things, your record keeping, how you handled the complaint, what decisions you made. But that, and the final thing is, if you have some qualifications, you know, that might actually help to defend yourself, or so that it comes across as this is somebody who, you know, they're adequately trained. They weren't practicing out with their scope. So that, hopefully, I just wanted to add that on for the masters, because I think that's some good advice. Regarding settlement in the UK, I'll be very honest with you. Most people in the UK don't know what their border rules are, because with Brexit, you know, and that's something that you're just going to have to speak to the Home Office. They obviously have, on the website, you'll find they have a tier system. There's certain levels of skills, there's certain professions. So I'm really sorry. You guys will probably have better people here that have managed to work in the country. Say, for argument, they came for a university course, then maybe like Dr. Mawish, they decided to work in the general practice. They've now been here for 5-6 years. Maybe, you know, they met somebody on the way, wallahu alam, maybe unki shadi hogi ya nahi hogi, then maybe there's a case being built that they can submit to the Home Office. But I'll defer that question, I'm sorry, to somebody who's more knowledgeable.
Okay, thank you, Dr. Asmar. Please, the participants, please don't mind. I know a lot of questions sound like people are looking for shortcuts. We Pakistanis are very known for that. Even for Jannah, we look for shortcut. So, you know, people are asking, can we skip IELTS? I mean, if you can't score good enough in IELTS, then if you can't speak their language, then I think you should forget shifting to that country. And please also do not focus on, I'm talking to the participants. They want to settle in the UK and they want to find a pathway for that, right? So someone is asking, can we get a job after PhD? Of course you can get a job, but again, like Dr. Smart summarized it, we have to change our thinking process. First, we have to adapt ourselves to their requirements. Okay. Again, I'm seeing questions. People want the UK government to adapt to our qualification. Anyways, there is another thing that I did not mention. I forgot it. Is one pathway where you actually start your own private practice in Pakistan. Unfortunately, after graduation, I've seen, I myself and my students, I see them all the time. I've been teaching for 7 years now. They're not trained enough to run an independent private practice. They're not simply trained enough. I wasn't trained enough. I admit it. Okay. And some of them are better trained than me, but still running a private practice is unregulated in Pakistan. Again, there are no regulatory bodies. They exist, but that's just on papers, okay? Nobody tells you how to manage your clinics, how to manage your patients. There's a lot of things that is going on in a private practice. So a lot of people experiment with it and some of them fail, and then they look into these pathways and they try to move abroad. So first thing is first, if you can't pass IELTS, I think you should forget thinking about moving to countries that have English as their first language. And the second thing is after MSc, I've seen some Pakistani graduates that completed their MSc and their masters are MSc leading to PhD, and they can continue their research work and enroll into the PhD program under the same professor and complete it. And obviously from there, they can find pathways and other, but still they are not licensed to practice as a dentist. Okay, they can find jobs in academic schools. I think the jobs that they find are academic or research based, but they're still not licensed to practice as a dentist. Am I right, Dr. Asma?
Sorry, my audio, could you just repeat that last point? Audio wasn't.
The graduates that the Pakistani graduates that enroll into MSc program and then continue to complete their PhDs in the UK.
Yeah,
they're still not licensed to practice as a dentist.
Yeah, I think again, I think Dr. Mavesh might be able to advise that you may be able to study, get a university position, but you really need that ORE registration. Because I think she did mention during our presentation that even on some postgraduate courses, they won't let you touch patients because at the end of the day, remember in the UK, it's about safety. So you may be able to do the educational component of, say, an MSc, but how are you going to treat the patient? Who's going to cover that? What's the indemnity? So I think you're right. And if you picked purely an educational MSc, for example, public health, there's no patient contact. You know, dental public health is a subspecialty in dentistry. And say you did a PhD in dental public health, you may be able to lecture, you may be able to present, but you won't be able to treat patients until you've obviously gone through the clinical licensing approvals. So I'm fairly confident about that.
Dr. Sarwar, can you please guide again that there are some participants that have completed their College of Physicians and Surgeons training in Pakistan, and they're asking, do they have to graduate in medicine in the UK to continue and enroll and register in the same specialty in the UK?
So in the UK, the oral maxillofacial surgery, you have to be dual qualified and you have to be registered with GMC and GDC. So there may be some people who must be at least eligible for entry to GDC register, but because maxillofacial surgery in the end is a medical specialty as per se, there's a debate. A lot of people and a lot of colleagues, but I know they've already given up their GDC registration because part of the GMC registration covers them for the purpose of maxillofacial surgery. So if anyone's completed their training in Pakistan, if they want to come and practice in the UK, they will have to complete the relevant exams, get the registration, or at least have the medical degree in order to work as a consultant. You have to go via the competitive training, specialty training pathway. There are other options. You can work as an associate specialist in certain areas, but again, it depends on what you've done before and how much experience you have. Most of the maxillofacial surgery jobs, if you're dental qualified, are usually staff grade jobs where you don't have to have medicine. But if you want to work as a consultant, you need to be dual qualified.
Okay, thank you. That was, I think, quite elaborative. One last question that I will actually, there are a lot of questions.
Sorry, just Zahin mein baat aa gayi about your last question about masters. You keep making the rightful point that we should ask the institution we're applying to what are their requirements. So if you are applying for further education and there is a patient component, the university may specify you need to have GDC registration. So aap unse puche, you ask them exactly the point you've been mentioning. They say, look, unfortunately, we cannot accept you unless you have the clinical license as well as your bachelor's, etc. Yeah? So again, coming back to your point, ask the institution that you're applying to what are the requirements in order to find out whether you'll be treating patients or not. I just wanted to add that point. Sorry about that.
Yes, exactly.
Just wanted to add another point that when you apply for a master's or any degree postgraduate, usually the university specifies what are the learning outcomes and what can you do following this. If you, for example, look at the King's website and look at the postgraduate courses, they clearly specify periodontology, for example, is registrable with the Royal College, whereas the orthodontics isn't. So I think that most universities on their website, they have a clear demarcation criteria, entry requirements, what it leads to, and then also I've seen they specify usually does it lead to registration or not. So I think that's quite useful to read.
Thank you very much.
Thank you.
Thank you very much, Dr. Ali Tahir. Actually, we are running short of time. This posting was supposed to be of 1 hour. One question from Dr. But maybe that is interesting for all the doctors who are listening to us from Pakistan. That you suggested that one should work as a dental therapist while they are appearing in the exam or completing their registration. Would you like to talk more about this? Because this is something which is, I believe, most people are not aware of.
Yeah, so recently, for the past 2 or 3 years, many of my colleagues, while they're preparing for the ORE LDS, they have applied to GDC to work as a dental hygienist or a therapist, because like I mentioned, the route is so long and it's so expensive. So it's very difficult to cover that. Like I mentioned, it's £20,000 separately need to pay for the exam and everything. So if you're working as a dental therapist and dental hygienist part-time, it really eases you in the system of the GDC. You know how to communicate with the patient, with your nurses, with your colleagues, how the system works, how you should be working in private dentistry, how you should be working in NHS dentistry, time management, because since one of my colleagues is already working here, they know that here time management is very important, that how you have to prioritize the case. So if you're working as a hygienist or a therapist, that it really helps you register for the dentistry training program. It worked out for me, to be honest, because whenever I sat for interviews, they asked me about my work experience. So they were expecting, in the back of their head, they were expecting, oh, she would say she has got overseas experience. But when I said, oh, I was working there and there as a dental therapist, that's when they preferred to hire me over other candidates, because they knew pretty much that we do not at least have to teach her about how we should interact with patients, about law and ethics, about different courses and about things like that. So it just makes your life easy if you just start to work as a hygienist or let's say as a therapist in the start.
Dr. But I'm going to take one step further. You know, what you did was, I mean, I hire associates. I've hired countless of associates. So if I was interviewing Dr. Butt and she mentioned, automatically she's right, I would think, Yejo, you know, this person has gone over and beyond what I thought. That's impressive, okay, what she said. Even if, okay, you do a nursing qualification, fast track nursing qualification and assist chair side, okay, even if you do that, because nursing qualifications you can even do in the UK through an independent provider in less than a year, and you can actually work whilst you nurse, so it can be done on the job. Even that speaks a lot about, because, you know, you can say to the employer that I know I'm a dentist, but I brought myself 10 levels down to learn about legalities, to learn about language, to overcome these obstacles. And that shows that you are one step ahead of everybody else. And these things, employers look for these things, okay? Jazakallah, Dr. But you should talk more than me. You're talking much more sense. But I just wanted to add that point, that even if it's not therapy, do a nursing qualification if it helps you.
You know, Dr. Akram, these are the things when we speak to our colleagues there in Pakistan, they think that we are talking some things from other planets. When we talk them to do some nursing or something like this. Okay, to sum up, last question for you, Dr. Butt, and then we will end the session. If I'm a BDS, I have graduated yesterday. Now I want to go to the UK. What practically A, B, C, D I should start from today if I graduated yesterday?
So you need to be in the right state of mind. You should know what you're looking for. Like my colleague
I want
already
to come
told
to
you.
the UK at any cost, and I don't have extra money as well, but for the exams only.
You do
You should
need
get
extra
married
money.
in the UK.
No, that's I wouldn't recommend.
Situation, actually, this is the situation.
No, I to be honest, you should sort these things out before putting someone else into your life. If that makes any sense, it would just be unfair on the other person. Plus,
It was just sarcasm, okay?
Yeah, no, of course, I understand that. But you need to keep finances in mind. You need to keep time in mind, because when you're studying for dentistry exam, you need to make sure that for 2 years, you either have some disposable income or you either work part-time as a dental nurse, as a dental therapist or a dental hygienist, or someone is funding you like your parents or your previous job, because you do need a lot of time, you do need a lot of finances, and you need to be mentally present in the exam. Otherwise, you'll just end up failing the exam. So if you're a fresh graduate, You need to have your priorities, and you need to write down everything on the paper about how much time and money and emotions you're going to invest in this one.
I believe there is need of some proper mentorship actually. Yeah, and then that mentors can take this person. So why not we today we are here, Dr. Ali Tahir, Dr. Akram, Dr. Sarwar, Dr. But why not we start a mentorship program for the dentists in Pakistan, just giving half hour, 30 minutes once a month? Because I believe as that there's a lot of guidance available for medicine. I'm teaching them for the last 10 years. I'm doing career counseling, but there's less guidance available for dentists. So why not you guys take this initiative from the forum of APPS, and we would love to give you this forum again and again whenever you would be available.
I'm more than happy to help my colleagues and to help my Pakistani dentist friends, because I've been in the same position and I was totally lost. So I'm willing to help.
Dr. Sarwar.
I'm very, very happy to help, and I think it's a great privilege. Over the years, we've tried to help a lot of children, even in the UK, from disadvantaged backgrounds, and we're trying to come over this power differential that you don't have to come from a medical family or a dental family to become a dentist or a doctor and do well. So from the surgical point of view, I have been mentoring a number of F2s. In fact, the ones I did last year, 10 of them ranked in the top 100 in the national selection. So I'm very, very happy, whatever way I can give time, be very happy to answer and help. And one thing I want to say was, I think motivation is key. Prioritization is important. And myself, as having done Royal College membership, complete core training, I'm a father of 2 children and a dental student at the moment. So I think where there's a will, there is a way. Just believing in self and believing that God is there to help you, it goes a long way, and just have to prioritize.
Okay, thank you, Dr. Akram.
Dr. Raza, I'm in need of a mentor myself. कोई मुझे बताए जिंदगी के क्या करना है, what are you doing, wasting your time. I'll be the first mentee. If Mohamed Sawyer gave such a good answer, I will be his mentee. He can guide me along the path. I think it's a fantastic initiative. I'm going to be honest, because when, as Dr. Butt will tell you, Scottish people are very, very upfront. They wear they wear everything on the sleeve. I was only here filling in for Dr. Sharaz, my good friend in Glasgow, and I was very happy and honored to see this initiative. And if I can do anything more, I mean, I know that there was a sort of a comment there earlier where Dr. Mahesh Bhatt replied to say that you need to plan and have your finances. She made a very good point. Okay, agar aap kisi ka hak nahi ada kar sakte, if you cannot fulfill the rights, whether it's apps and doing this mentoring, then my general principle is to say no, even though I may want to do it. So I will try my best to do whatever we can. But if I do say no, please, it's not because I don't want to, it's because at the end of the day, if somebody gets married to somebody and they're doing it for the wrong reasons and they can't look after the other person in their life, then it causes more problems. Okay, you don't want to screw with somebody's career at the end of the day. But I do encourage you guys, go forward. I'll need to skip. I've just got one last thing that I want to mention. Just one last thing, okay? I'm born and brought up in the UK, but हमारे वालिदैन की वजह से I have lots of बहुत मोहब्बत है, not just for Pakistan, but the old Hind system before the borders were on. And I remember when I was a child, I'd go to Pakistan, they'd say कि हाँ जी मुंडा तो कित्थों आया? And I would say कि Scotland, Glasgow, and they would look at you as if they've never heard of it, say London. And you try to explain to them, to say, no, it's Glasgow. And at the end of the day, bahar ke banda hi kahenge, I'm from London. Theek hai? Har jagah bande London. So you've grown up thinking that people have this, and the listeners will know they have this aspiration that one day they're going to come to the UK, that one day they're going to practice dentistry, which inshallah I make dua, if that's what is destined for you, Allah will give you blessing. But, now here's the but. I've seen lots of people who they put lots of effort in. Dhakke khate hain. You guys all the time, dhakke khate hain, yeah? They really, they do nursing, they grind out. And then, when they finish, they realize that the UK wasn't everything they thought it was, especially now. The UK is not the same country it was 40 years ago. Nothing, you're going to say nothing's what it was 40, 50 years ago. So please take advice from people that are your seniors. Always look at, with implants, for instance, there's lots of surgeons that will say, I've done 1,000 implants, and you think, wah, ji, We say, when did you place them? I placed them in the last 2 years. तो आप सोचेंगे कि बड़ा काम कर लिया है. But what if all of them fail in 20 years? Okay, you've been impressed by someone, आपको धोखा दे गया है, because दुनिया में धोखा बहुत होता है. Not sometimes deliberately, sometimes we do it inadvertently, कि मुझे देखो मैंने क्या किया है. So please, I'm encourage my brothers and sisters, and literally, I know people that were born and brought in the UK that now want to move back to Pakistan, and they've never lived in Pakistan. They just have, grandparents. अब ये जो लोग सुन रहे हैं, saying, यार ये कौन सा बात कर रहा है, that we want to go there, and he's talking about people want to come from there to there. It's an increasing trend. Why? Because look, life's not all about your career, okay? It is an important aspect, and it should be something you're good at. But at the end of the day, if your career means that you lose out on your connection with Allah, you don't have stable family life, you don't have that sukoon when you sleep at night, okay? Then the question is, why are you giving 20 years and thousands of pounds to it? See, I'm not saying don't do it. What I'm saying to you is that think twice, mashwara karo, do istikhara, speak to an elder. And with that note, I like to thank again. I went away, but aapki muhabbat ki wajah se I came back in the room. I'm actually training somebody in the room next door. So please make dua for me. I'm really sorry if I've said anything untoward. It was an absolute joy meeting you, and hopefully Allah Pak gives us the opportunity to meet again. Jazakumullah khaira. Assalamu alaikum wa rahmatullah.
Thank you very much. Lovely message. And Dr. Ali Tahir, would you like to coordinate this initiative from Pakistan?
Oh, I'm happy to help.
Thank you very much. Dr. Irfan Sheed, you are with us. What is the last, you are the most senior person here. So last message from you.
No, I'm, thank you. I've been joining in and out because I'm host. I couldn't shut it down. Otherwise, meeting would have finished. So I may have missed some part. But I think the message from me, just for people, keep joining the APPSUK's webinar series. Plenty of educational activities, educational webinars we will be doing the next few months or coming years, inshallah.
Thank you very much. Dr. Chamana Rooj, would you like to conclude the session?
Thank you, Dr. Raza. I think it was a very informative talk and a very interesting one as well. Because I hope all the dentists, they were benefited with this conversation. Many thanks to all of our distinguished speakers. I think Dr. Akram has left, but all of the rest of you were there. Thank you. Thank you for joining us and making this possible for us. I hope for all the audience, we were able to answer your questions. If you still have questions, we do have this. We are kind of launching this sort of program of mentorship, which Dr. Tahir is kindly going to facilitate. We hope we'll be doing more sessions on this topic, and I know this definitely was not complete. This does not complete the whole conversation, but we will hope to see you again, and we'll continue from there. So
thank you very much.
Anything from your side, yeah, Dr. Azhar?
The recording of this session will be available on APPS UK Facebook pages. You can be an APPS UK member by logging into our website and filling the form. Thank you very much, everyone.
Thank you very much, everyone.
Thank you.